Hello, my name is Charles Lux, and I'm here with my mother, Tina Lux, to talk about her role in caretaking of people with special needs. Hello, Mrs. Lux.
Hello.
First, this is being recorded. Is that all right with you?
Yes, it is.
Okay, let's start with your background. What is your background?
My background is providing care for the disabled and elderly, and it's basically home health care. We do monitor medications and provide the necessary care for each individual that's in the home.
Okay. How do you feel about your profession?
I enjoy it. I've been doing this profession for a very long time.
Do you get a sense of satisfaction from it?
I do.
Why?
Mostly because the clients that we work with give me insight on how to interact with each individual's needs.
Mm. What would you say are some of the more difficult aspects of your profession?
Some of the most difficult aspects of that are required for my profession is that we can get difficult clients that can be violent. And they can be suicidal watch and stuff like that.
Have they ever attacked you personally?
Not me personally, but other individuals in the home, yes.
Ooh, how violent did it get, do you think?
And one situation, the police did have to be dispersed out to the home and remove the individual that was causing a scene.
And what is the protocol for your company for that to work?
The protocol is to see if you can separate the individuals, give them redirection, and if at that point it cannot be resolved at that point, and the individual is being very violent, as in swinging, biting, pulling hair, that type of stuff, we have to call 911 at that point because they're a danger to everybody in the home. You
said you deal with medications and prescriptions. What's the protocol for that?
We go through training and we learn each individual's needs on medication. There's a lot of psychological medication that the individuals will be taking for depression, for their health needs, etc. So we have to be understanding what these medications are for, why they're needed to be given at a specific time, stuff like that.
What do you think was the biggest thing you had to learn in this profession?
I honestly don't know what for me on this particular question for me, because I've been in this field for a very, very long time. My brother, my sister had these type of needs. My own son, Alexander, has these type of needs. So for me, coming from a position of already being very knowledgeable of special needs and the education that's needed, I didn't particularly need to be trained on particular needs.
And your son, Alexander, has exactly what?
Down syndrome, and he's mentally retarded as well. He also has a learning speech impediment and learning disability.
Did you know about this early on, or
no? With Alexander, the diagnoses were given at the time of birth.
And
for the Down syndrome, at least.
Time of birth, so you didn't know ahead of time at all?
No. They did blood work, as they always do with pregnant women. They give blood work, follow-ups, and stuff like that. I was 20 when I gave birth to him, and I'm not at high risk for Down syndrome specifically because it doesn't genetically run in my family. It's an off gene that does it happen to an off gene person.
How did you feel as a mother of a Down syndrome early on, at birth?
I was confused. I was lost. I didn't know where I needed to turn, how to give him the proper assistance that he's going to need in life. I had to do a lot of research. I had to, early on, they were asking me if day 2, they were asking me if I would give him up for adoption. And I just was so overwhelmed with the doctors throwing that in my face, like, because I was so young when I gave birth to him. They felt like I couldn't provide for him, and I'm just like, you know what? I'm his mom. I know what I want, and this is my son, and you can't tell me how to run my life.
What were some of the things you had to learn when you were raising him?
Some of the things I needed to learn raising him is his communication skills. He has very limited communication skills, so he has a lot of babble. So understanding his babble and understanding why he gets frustrated because he can't communicate was some of the things that were a little bit harder to understand as a mother. As a provider, I understand, to a small degree, but on other degrees, it's just like, I get it.
Mm-hmm. Did you have to look for certain schools to help him, or certain teachers?
Luckily for me, when getting into the systems and stuff like that, the school system directed me on how to get him the education he needed. He started education at a young age because of the speech problem, because of the mental retardation problem, because the fact that he falls under a lot of categories. So he got a lot of assistance through the school. At the time we were living in California, they helped me all the way, in my opinion.
Would you say social skills were particularly hard for him?
I would say so, but he's kind of, you earn his respect, you earn his loyalty. Mm-hmm. He's that type of a person. He can be standoffish at times, but once you've proven to him that, hey, we're here to help you, he's pretty relaxed.
And how did raising a boy with a Down syndrome help you with your profession?
I think by giving me that experience firsthand, I can give my experience with other people that are in that same category listed, my experience, and see if it helps them benefit from what I've learned. For instance, like, I got a book that Alex could just point to pictures to communicate his needs. Some people never thought of that type of solution to communicate with him.
And do you think it hurt some of those people who haven't gone through that training before?
I don't know. I don't think so.
Don't think so?
I don't think so.
You think anybody could do it with the proper amount of understanding?
I think so. I think if you have patience and you have the willpower to want to sit down and figure things out, that you can manage this. I won't say easy, but it's manageable.
Mm-hmm. What's the average age of your clients?
My clients are generally older, so they're in their late 60s to early 80s, depending on each individual. The youngest client currently in the home is 35.
35. Of course, since we're dealing with such a older demographic, is there any tragic events that have happened with you?
Yes. In this field, I've done individual care, and I've done a full-time, just straight up in a home of clients. I sat on a case where the lady happened to pass away the day I was sitting with her.
How did that affect you?
I cried. I honestly cried because I was with the lady for a week straight. When I first met her, she looked very strong, very outgoing, and we had a doctor's appointment, and whatever the doctors told her at that point, she declined her health. Her health declined very rapidly. She went into basically what we call failing health, and she was in bed rest, and I spent 24 hours with her when on the 18th hour she passed away.
And as your son gets older, Are you? Do you see what could possibly happen?
I have high hopes for Alexander because he has a supporting team around him.
So do you worry about him when you get older and you eventually pass?
I do, and it's the reason I get worried is because an individual that was living in my home was Down syndrome, and she was very close with her mother, and Alex is very close with me. And her mother went into failure of health, and she passed away. And a week later, the young lady passed away as well.
And what could you say would what would you give advice to people who are trying to get into this profession to help people with special needs?
Education, really education. Be very patient, be understanding, be open-minded. Don't just judge one person of their needs and try to push those needs onto somebody else. Each individual is different. Everybody's needs is different.
And what would you say? Would you have any advice for people to interact with people with Down syndrome?
Don't treat them like they're stupid. Really, that's my basic idea with Alex has been treat him like an individual. Don't treat him like he's sick. Don't treat him like he's ill. Don't treat him as if he's different.
And do you have any final words about what people would need to know about you and your profession?
If this is a profession that you're trying to get into, just be willing to put the work in.
Okay. I want to say thank you for this interview, and thank you for letting me interview you.
No problem.